Hello dear friends, let us see about the anatomy of this femur bone itself and the bone. What we have discussed up to now, we have said that the femur bone is it is a typical long bone, right? And this bone must contain an upper part, middle shaft and a lower part, right? Because it is a long bone. So all the long bones has two epiphyses, the proximal and the distal, and then there is a diaphysis. Done. Then we said that this is the strongest bone and the longest bone and the heaviest bone of the body. Okay, and it has an upper part, it has a lower part, and it has a middle part, right? Okay, we wanted to discuss the femur bone in three different lectures. We discussed about the theory of the upper part, which is on the whiteboard, and I hope you have watched that also, right? Then we will discuss about the shaft and we will discuss about the lower end in the next lecture. Now we have already discussed about the theory of this upper part of this bone, and we had said this upper part has many different parts, right? Now let's discuss those important points. First important point, how to determine either this is a right femur or a left femur. How to know that either it is right or left. So for site determination of this bone, we should keep the bone in a position so that we will know that either it is right or left. Now look, what are those important points from which you can recognize the bone is right or left? First, the head should be medially, right? If we have here the pelvic bone, right? So the head should be medially, right? Okay. Then the next point, if you keep the head medially, then in the lower end of it has posteriorly a fossa here, and this fossa should be posteriorly, right? The head medially, and this intercondylar fossa should be present posteriorly. Then you will recognize that this femur is right or left. That's the two important points from which you can recognize. What are those? The first, the head should be medially towards the midline. That's so simple. If you hold it like this, right, then it is going away. But if you say that now, what about now? Is it not medially? Yes, the head is medially. But what about the intercondylar fossa? The intercondylar fossa in this diagram is anteriorly. But I told you that the intercondylar fossa should be backward, should be posteriorly. So if you do that, look carefully, if you bring this femur medially, the head medially, right, then the intercondylar fossa has gone backward posteriorly. Now you can say that this is a right femur. And what about this one? Look, the head is medially, the intercondylar fossa is posteriorly. That's so simple. This is left femur. Other than this, you can also say that if you keep the head medially and the patellar surface anteriorly, you will strongly and you will fastly recognize as that right femur or a left femur. Again, the head medially and the patellar surface anteriorly, you will find right or left. And for this one, look, the head is medially and the patellar surface of both of them is anteriorly. So this is the right one and this is the left one. Done. Next important points. Look, we have said that we will discuss this bone in three important parts. And what are those? There will be the upper part of this bone, right? So this is actually the upper part, right? From the black line downward, this is the shaft. From the black line upward, this is the upper end of this bone, right? And so is the case for lower end. Now in the upper end, we have said that we discussed about the head. We said there is a head, there is a neck, there is a greater trochanter, there is a lesser trochanter, there is the intertrochanteric line, and there is the intertrochanteric crest, right? Look carefully. About the head, this is the head. The head is, I have written while I was discussing about the theory, the head is a half a sphere, right? It is located medially, upward and a little bit forward. It is located medially, upward and a little bit forward, right? And then we have said that it has a central depressed and a medial depressed part, a rough pit, and this rough pit is called the fovea, right? To which the ligamentum femoris is attached and makes the joint which is called the hip joint, right? So this is called the fovea. This is the rounded head. Next, there is the neck of this bone. Look here, this is the neck, right? Now, as I told you, the neck has two borders, right? This is the upper border and here is the lower border. So how many borders it has? It has an upper border and it has a lower border. And then we said that it has two surfaces, right? So we said this is the anterior surface, right? And here is the posterior surface. And I have already written the details of these in the lecture on the theory, right? You keep your copy in front of you, you will find all these things. So there is the posterior surface and there is the anterior surface. So the head has fovea, right? Then there is the neck has an upper border and a lower border, anterior surface, posterior surface, right? Then there is this quadrate shape bony eminence. This is called the greater trochanter. Let me share it. This part is called the greater trochanter, right? So this is the greater trochanter, right? We have said that the greater trochanter is actually having one border and this border has an apex. So this is the apex of the greater trochanter, right? This is the apex, the pointed part, apex. Then there are three surfaces, right? One was the medial surface, the lateral surface and the anterior surface. So how many surfaces the greater trochanter has? It has three surfaces. What are those? The lateral surface, the anterior surface and the medial surface. Okay, I have told you that the anterior surface is a little bit rough, right? There is the lateral surface and then there is the medial surface, and this medial surface has a depressed part in it, right? That is the depressed part in it. Okay, right friends? And this depressed part is called the trochanteric fossa, right? So there is a fossa in it. The medial surface of the greater trochanter has a fossa in it, and this fossa is called the trochanteric fossa. I hope you can see it, right? There is the trochanteric fossa. Next was the lesser trochanter, this one. So here is your lesser trochanter, right friends? This is lesser trochanter, and I have told you that the lesser trochanter, right, is a cone shape bony prominence, right? You can see it. This is the lesser trochanter, right? And it is pointed backward medially. It is pointed, it is located backward and medially. If you have the bone in your hand, you will easily know that this lesser trochanter is located medially and backward, right friends? Then there is the intertrochanteric line. Here we have that. Here is the intertrochanteric line, right friend? Intertrochanteric line is anteriorly. So this is the left femur, so this is the anterior side. So this is the intertrochanteric line. And here is the intertrochanteric crest, and the crest is located posteriorly, right? So the intertrochanteric crest, intertrochanteric line, and I had told you that this intertrochanteric crest actually has this quadrate tubercle, right? So this point which I have shared here, this is the end, this is the quadrate tubercle of the femur bone, right friends? So fastly repeat, okay, how to determine the site. The head should be medially and the intercondylar fossa should be backward, or the patellar surface should be anteriorly, right? Then the upper part has a head, it has a neck, it has a greater trochanter, it has a lesser trochanter, it has an intertrochanteric line, and it has an intertrochanteric crest, and it has a quadrate tubercle, right friends? So there is a central depressed part of the head which is called the fovea. Then there is the this depressed part, right? This is called the trochanteric fossa, right? So we have discussed all the parts of the upper end of the femur bone. And in the next lecture we will go towards the shaft and we will discuss all the important markings on the shaft. So I hope you like the lecture, friends. See you in the next lecture. Till then, Allah Hafiz.